So we're here back on the floor at Chicago Midwinter with our famous DINKs booth, which I love. Here with one of my dear friends, Dr. Patricia Torres. She's going to spend a few minutes chatting with us about her journey as a dentist, a foreign trained dentist, and what her career has been like.
Venezuela, yes.
Yes, which probably was an interesting journey.
It is. Actually, it is.
Talk to me a little bit about, you were trained in Venezuela. You're from Venezuela. How long did you practice there before?
I worked in my private practice for 11 years.
Okay.
I'm a GP dentist with extensive training in orthodontics as well. So back in the time, of course, I did a certification in orthodontics and also brackets and wires for a little bit. And then restorative dentistry. We were, the office still exists. It's a multidisciplinary practice. So he did dentist, and we have a prosthodontist. And also we had a couple of orthodontists in the group. So I took the simple cases, and then the other cases were referred.
Yeah.
And I moved to Canada in 2007.
What was that? I mean, tell me a little bit about that. Did you know anyone in Canada? Was there
No, at all.
nothing?
Yeah.
No one?
Yeah. Sometimes there are moments in your life that you are clear that sometimes the space you are in is not bringing all the things you would like to have. And I knew for the reasons, sometimes politics get in the way.
Yeah.
And of course, I won't elaborate too much on that, but I knew that because of the situation of the country on the technological side, I wouldn't keep up with technology. So I knew that I had to do a move. So, Canada had the opportunity for foreign trained people. So the skilled work program is called.
Okay.
So of course, the application process is not easy. It started in 2004. And it took me 3 years. I had to learn French because you are moving to another country. And not only that, you had to be proficient in 2 languages. I did have the English since I was 12, right? And I love languages, always loved languages. And it's funny because I went to Brazil for a little bit to pursue my master's degree in ortho. But then sadly, life got in the way. My mom got sick, and I had to come back to take care of her. I'm only daughter. So of course, for me, it was more important to support my mom at that time. And I don't regret that. But after when I came back, I knew that it's better to seek for other opportunities. And then is when I decided to move to Canada. So it's easy to say, but I actually packed 2 suitcases, is real, and 2 square meters in a container of my goods. And I moved to Canada. I landed in Canada in September 2007 by myself, not knowing anybody. I knew someone that I met over the internet. We Skype.
Yeah.
A couple of weeks prior to my arrival, and I arrived into his house. I stayed there for 2 weeks, and then he helped me to find another apartment, and then the rest is history.
So you came to Canada. I would assume your intent was to practice dentistry, to become a newly licensed doctor in that country and sort of move through that process. Tell me how it went. How was the journey?
Sure. So, of course, it took time to first get my first job. I started working in June 2008. I was very blessed to meet one of the chief surgeons at McGill University, and I work in his private practice for implants and all things surgery. So I worked with him for 1.5 years.
But not as a doctor,
no,
right?
As a dental assistant.
Right.
And it was cool because I really had an opportunity to see firsthand all the implants, sinus lifts, and all those things. So in some extent, it was a little bit of a residency.
Yeah.
And that was something that brings some, hard moments with my boss, because he said, well, you are not here in a fellowship. You are here to work as a dental assistant. It was hard, but of course, I could cope with that. Yeah. And at the end, I moved to another practice with an orthodontist where it was more my bread and butter. And I worked with him as well for 1.5 years more. At that time, I think it was more adapting to the new culture, understanding how the profession went. And of course, I was not only working, I was working part-time because I was preparing myself for the boards. So I took my first board exam and sadly I couldn't make it. Then I prepared again the second time and I was just 2 points from the passing grade. And then I had an opportunity through this network of dentists. So there is this other clinician from Colombia that knew someone at online technology. Then they were looking for someone that was able to train in French and English. And I got hired as a clinical trainer for Lyme technology. So I started working as a trainer. And then I realized that I loved that part of the education, right? So of course, I put in a halt my boarding process, but I started developing myself in all things education. So I pursue a certificate in adult education with the Association of Talent Development. That's a board in the U.S. that really concentrates everything related to business functions that can be from the training perspective, because of course companies need trained people. And then we have also all the managerial things. So I focus myself, and it's funny because it was kind of coming back to my roots. My parents both were educators, and I always was around education, right? So I started doing more e-learning and developing myself in e-learning and training facilitation, adult education. And of course, sure enough, after that amount of time in the company, I started escalating into the corporate ladder. And today I'm working at the clinical education team. And actually, that's the reason we met.
That's
right?
exactly right.
So my job today is kind of being a speaker coach, where I help them I know how the product works, and then I help just to bring their story to life in a way more compelling way. So I take a lot of advantages of my knowledge as a clinician, and also with the business side, because I already have 13 years into this corporate world.
Right.
And I really feel that it's a wonderful way to put together two different things.
So I have two questions. The first is, when you came to a new country, new culture, obviously a new language that you were sort of adapting your understanding of dentistry. And can you talk a little bit about the experience of now treatment planning? I mean, treatment planning is hard as a clinician in your own language, with your own culture, with where you were educated, and then you're expected to go out. I can't imagine the psychology, the emotions, the intelligence, the challenge that would come with now trying to start to think about treatment planning and talking to patients about treatment acceptance in a foreign tongue with a new culture. And did you find that to be true, or is dentistry, and it sort of translates once you get comfortable?
I know that's a very common question, because people think that sometimes universities doesn't work or run the same way, or the education is different. But I'm very blessed to say that most of my mentors at university came from the U.S. They did their master's degree in the U.S., so we did have already the same framework. So for me, that part, it was a safe place. Because to your point, of course, I had to learn the new terminology, but in terms of the know-how was very similar. Right? So that's really good. At the same time, I feel that also at the time I moved to Canada, it was that technological leap that everything accelerated.
Right.
So I was actually drinking from the fountain from the get-go. What I'm saying is that back in 2007 backwards, the technology was not at the place it is today.
That's right.
So I actually grew into that technology already in the US and Canada environment. So for me, it will be a hard thing to do is the opposite. Going back there, because when you speak more than one language, you have different compartments. So sadly, my compartments in that specific matter in Spanish is almost empty. Because,
You
yeah,
haven't used it.
exactly. So it's funny.
That's really fascinating,
It is
actually.
fascinating.
You don't
So-
even think about the inverse part of that being true at all.
And people will maybe think about, oh, she's so stupid. She's pretending that she doesn't know. No, it's like I need to, purposely take all those words and fill those cases
Yeah.
to fill that bucket because
Yeah.
that bucket is empty. So it is really cool.
The other question I had for you was imagining now if you could tell your younger self before you packed your little boxes and your suitcases and you moved to Canada, I know you probably thought you were going to be a dentist.
Yeah.
And I think your journey has been incredibly impactful but different.
Yes.
Any words of wisdom to your younger self or to anybody watching who might be in similar positions, or maybe they are wanting to transition out of clinical for a variety of reasons? I mean, we know it's been a lot harder on doctors in general. The burnout rate is significantly higher. So how do you re-envision yourself as something different than you thought you were?
I think it's so beautiful because all the knowledge I accumulated back in the time, the only thing I would say to myself is everything is going to be okay, because on top of dentistry for me is technology. So getting all those skills to put that at the service of technology in the future.
Oh, yeah.
Is something that still today is true. So what I would say for other people is that if you like your profession, you can utilize all that knowledge and put that at the service of what's the future. So we have already AI. We have already, we have AR, VR. We are in a generation, I'm Gen X and I'm not shy to say it, but we are in a generation with our kids are already native to technology. So the dentistry of the future is not the same dentistry we study. And we can close that gap because we can help that technology leap, but with the knowledge we have.
Right.
So what I say is that if you are a foreign trained dentist and you really love your career, there are more than just seeing again patients. Think about all the things you can help from the patient perspective in education using technology.
And leveraging your multi-languages, I don't think people appreciate that as much. To your point, you were brought on because you could help educate in a market that they needed support from additional languages being able to help those doctors. So I think that there's a lot of opportunity that people probably don't even realize that companies are looking for.
You will be surprised. For instance, first and foremost, the U.S. Hispanic population is huge. It's more than 50 million people, which is more than some of the countries in Latin America.
That's right.
Number one. Number two, I train a lot of offices in Spanish in the U.S., which not only the doctor and the team speak. So first, we are a very global community today. And of course, there are Asian doctors that also have Indian doctors that have their stuff. So of course, we have to accommodate those, number one. Yeah. Number two, I train doctors in French in Louisiana. I was in Baton Rouge.
I can totally imagine.
And the doctors were Acadians and they were so Cajun. And they were so oh, this is so amazing that you can speak French.
That's so awesome.
In the middle of the U.S.
Right.
So, it is important to as well to help people to grasp all the things, because we take for granted that, of course, English is the language of business and communication. But when you can really get more to the level of eye to eye, heart to heart in your native language is always a plus.
Last question that I'm sure everybody wants to know. Did you have to carve a bar of soap for your Canada board exams?
Of course I did.
When I was studying for the DAT in the U.S., I had a few Canadian colleagues that were also studying for their board exams, but they would have their little bars of soap and their little kit, and I was fascinated. I said, why do you have all these things? And they said, oh, it's part of our exam. I said, it's actually pretty fascinating.
Yeah, it is funny.
Probably a pretty good way to vet out whether or not you're any good with your hands, which the public really would appreciate.
No, it's
that doctors can manage their hands.
The skill set you need to hit. That is something so delicate.
That's right. That's right.
It's really impressive.
Were you good at it? Thank you so much for spending a few minutes with us. I know you're going to be busy most of today and tomorrow on the floor. A lot of buzz and excitement here. So it's always fun to be in Chicago, except that it's 5 degrees outside.
Oh, well, for me, it's okay.
Oh,
We
yeah.
got
Oh,
it,
yeah. You
so
live in Montreal. So
I'm
this
so
is like
easy.
summer for you.
No, it is not. It's the same. It's like
Just-
home.
Yeah, yeah,
Less
yeah.
snow, though. We had a lot of snow
Yeah.
this year.
We didn't.
Thank you so much for your
Thank
time.
you, Dr. Torres. We appreciate it.